Me been find out lo sick lo year 2016. Time me been carrying little girl when die lo name. All been talking me say me got sick HIV. Me got two pikinini. Little boy blow me first. Na little girl mem die. So lo 2017 me pla ogeta been go lo house sick me pla ogeta kisim test lo me pla triple one time positive. Little boy blow me one time. Daddy blow him na me. So see close to na this la kind, but once me plus start the treatment blow him, like me looking body blow him improve. And I stay all come story lo me how must no go through. Me talk I'm good plan. Me talk you know say before me plus I go and then give blood test and then go the next review, but so you plan carry machine come na like sorting me plan and then otoki me or some binatan step inside the body blow him and go down. Me and mamas talk thank you.
My name is Paulus Ripa. I'm a pediatrician and I'm now also the director of clinical excellence and standards within the Western Islands PHA. My initial experience with the children with HIV was when working on the wards. I came across children who were having opportunistic infections, the advanced HIV, and finding out that they had been waiting for the results for their early infant diagnosis. So the blood tests which were collected and sent to Port Moresby, the results didn't come back quickly. It took a long time, a median time of 21 weeks to come, and many of these kids would have stopped their prophylaxis and then they were unprotected if they were HIV positive. So this pushed me to work with the ACTUP program to see if we could get gene expertise so that we could have the test done at 6 weeks, identify these children who needed to be on ART early.
Name to me, Sister Teresa Mac. Me walk inside lawyer. Walk lo antenatal, go lo labor ward, go lo Ilari clinic. 2010 me plus start lo testing all baby ya. Policy block government talk at same time. Baby 6 weeks must make him test. So this la time me plus testing all baby. Monday to Friday test. Okay, Friday all kita me plus pick him up na Salim go so go lo Moresby now. Sa take him 2 weeks. Sambla time machine bagrap now. Me plus no sakisim result area. So test sambla result me plus kisim sambla take him 2 months, sambla take him 3 months, sambla 6 months. Na this la side blood testing go good lick. Iga time where me plan no kisim result. All talking me plan lo repeat him test. Na give him pen lo pigini. Nara pla pen wal mama sa pilim na me plan tu sa pilim nongu tu. Na make him planti mama or like kisim result lo pigini na kamya also give up na me lo rot because bas fe nara pla something. So this la make him planti mama all drop out lo program. We all know kisim result. So time me plus start lo working test lo all baby na kisim result time man. All mama too amamas na me pla all nest too. Me pla amamas lo lookim at work lo me pla ya. Me pla lookim amas la baby me pla save him.
My name is Dr. Peniel Boas. I'm currently the program manager for the National STI HIV program under the Public Health Division of the National Department of Health. been so passionate about new things that we can embrace in the program in terms of moving with the new technologies that we have. So ACTUP has really transformed the life of especially the families, the mother, the children who have been having access to the program point of care services which we never had before. So now with the ACTUP program, you've seen some promising result there for children. We are able to diagnose them early, as early as 6 weeks, and we can even do the viral load to children, which we never used to do that before. And ACTUP has brought the service to the children, and then we can then plan the ongoing management of children, because we've been losing a lot more children to HIV because we never diagnose them early, we never know their viral load, and then we never treat them, and then we lose those children. But with this ACTUP program, we can diagnose them early. When they're negative, we make sure that they remain negative.
All over the world now, point of care testing is the way to go, so that patients don't have the inconvenience of waiting for results or coming back. There was one case where there was a mother of 3 children. She had been identified as HIV positive when the first baby was born. So that boy is about 7 years old, he's positive. And then the second baby had dried blood spots sent to Port Moresby. And because she and her husband were very compliant, this second child turned out negative. But for 9 months, they didn't know the result. They were very anxious. They went back and forth. They almost gave up bus fares and stuff. Every time they came, they said the result is not ready. It hasn't come back from Moresby. And then the third child, she was there for the early infant diagnosis, and we gave her the result on the spot, and she cried because she said, you know, I thought I was going to go through the same thing, but now I know that this child is negative.
Name Lomi Petrus. Me now current Provincial HIV/AIDS Services Coordinator and Anitlo West Highlands Provincial Health Authority. Alongside lol piginini, even long detecting whether HIV is stable or not. And me plus a bleeding asylum go tamlo long Moresby. And plenty time. By the time I'm developing plenty opportunistic infections. Na plenty time me plus losing all. And samples now I'm stable here. You me run him liana. You me kiss him whether baby I'm positive or negative. You me kiss him now yet. Check him virus belong baby right on the spot. Lo iya yet. As long as you me looking most positive, now I'm testing treat. So me plus put him lo marcin. So but now also like helping belong ACTUP. Me plus looking service provision platform also kind of some game change. And by changing scenario belong HIV care and treatment.
Na site lo EID testing lo begini me looking also and by helping me plus big time, especially also no plus married na all HIV positive na all what worry thing also. True baby blow me by negative or not. Me got 1 plus senis by Stap or not. Na all amamas lo disla na all living life na all bakarim number 2, number 3, number 4 baby because all survey also. This la service me bla provide him. Good la service na encourage him all plenty online. Past time you bla sa talk ya result no sa kamare na. Me bla go come Western bus fare na. This la sa making me bla week all get na me bla last year. Number 2, number 3 beginning me no test him ya. Now you bla make him test here. Now yet makes him result na. Hey me amamas ya this la ya nice through all toko na. This la making me bla all nest amamas na. Me bla like make him more work ko more yet na. Kiss him plenty baby na work him test too.
Okay, I'm Sister Kalebi. I'm working at Moresby General Hospital. Now with that machine, it will help us to see the results and disclose the results same time to the patient, to the caregivers. The clinicians are able to see the results and manage the patients and see whether the patient is doing well on ART or not. And that will help us manage the children who have HIV. I'm really proud to have this machine here. We're collecting the blood through the vein, and I want to put it into the small EDTA bottle and then run it through the viral load machine. But for EID, we're using the Gene Expert machine, which the the technicians does the running of the samples. Whereas for the viral load, for less than 10 years, we're going to, now that we are trained, we are able to run the test ourselves as well at the point of care.
Nem lo mi am rutai, mi work la Hagen Ausik, want them Paediatric HIV inside the Western Highlands Hospital Mount Hagen. Plenty time all mama like harem result straight now so wait go na mi no give him result hurry up and more some belat na go. But now this like gene expect machine na mi give him result hurry up na plenty will come back nor talk mi na to osem. I am nice straight you make him easy lo mi kiss him result hurry up na osem give him susu plenty or sigman lo mi all also come talk thank you lo mi MP ma machine by help me good. And this la machine blow check him blow body inside lo all marasin pigini. Past time mi sagis him viral load blow all pigini antab lo 10 years na igo antab na pigini antanit lo 10 years na come down ose mi no busy. Past time mi no sa look sabe how em blood ya. Stabin se lo skin na mi bahat lo look sabe so machine na am talking mi osem pigini kisi marasin good or no kisi marasin good. So result come back na planti mi kisi osem not detected. Osem viral load blow le suppress em good la result. Usati kisi marasin good na stable mag blow le mi talking more continue lo kisi marasin osem so that you know na pain nar sick apart from HIV. Usat pigini yumi kisi viral load blow result na viral load blow iguantab namba iguantab em yumi sa talking more mi come back again so mi sa give more school talk lo pigini mas kisi marasin lo papa mama mi sa give more talk lo mi sa schooling more again osem marasin you know sa drink so now you must drink good you know drink na looking bloody talking mi osem you know sa drink marasin so you drink marasin na mi give you you know height ikat one machine sa talking mi Stap so mi sa talking more straight na next run or come back after 3 months mi kisim again na blood level blow right now mi sa talk osem I'm good you must stop osem mi amma straight lo kisim this la MP ma machine come back come inside the Hillary Clinic.
I am Dr. Gideon. I am the Regional Medical Officer and working with the National HIV Program. The issue of the point of care testing for children is paramount. The new technologies that are coming on are making it possible. I think all of us need to really be happy that technology is making it possible for us. We don't need to keep people waiting, because one of the biggest challenges, and I think the anecdotal evidence has shown that a lot of mothers, because the results are not coming back, the turnaround time is too long, we are losing them. And now we are leaping onto the next platform is to make sure our people who are on the drugs are safe. They're virally suppressed and transmission is prevented in those who are already infected that we know. I want to thank the ACTUP program. I commend every other institution that has come on board, and the University of New South Wales, the Kirby Institute, the Institute of Medical Research, and the leadership provided by National Department.
Kissing blood test. I mean, something blow porret or something blow sebo. By look out him you behind time. I mean, like him all, nurse now doctors, lo must talk strong, lo parents. Lo strong ni mo lo sem. All no can lose hope lo carry mo pikinini kam. So must have beken next. Kisim blood test, blonol, and at the same day too must kisim result blonol. All by checking all of them. Virus one them blonol them go down, no them stop untap na disla. So all by save, if all pikinini work lo drinking all marasin blonol or nogat, you must focus lo marasin. All doctors talk him through. Now you may just have to accept him or say you may got disla sick. And by me living ordinary life or say mo narapla. I feel him more right now. It's like how normal life me plus I live him lonem. Plan make sure that me plus drinking marasin lo time. I don't know something blow say. Me ha mamas. Me talk thank you lo line where I'll provide him this land machine. Yeah. Me like in future blonem lo. Behind time and by sit down good. By school good, by work good. And by married and by stop. I'm one time family. I'm look me.